Erectile dysfunction is defined as the persistent inability to get or maintain erections sufficient for intercourse in at least 50% of attempts, meaning difficulty getting or keeping erections at least half of the time you're trying to have sex. Erectile dysfunction is incredibly common. It affects about 40% of men age 40 and over, and as men get older, it increases in prevalence, meaning more men experience it the older they get. Erectile dysfunction can be caused by many different things, but the most common things pertain to the blood flow to the penis. Conditions like diabetes, high blood pressure, a background of having heart disease or coronary artery disease can all be causes or linked to erectile dysfunction. Other things like prostate cancer treatment, including surgery or radiation, are also common causes. And then less commonly, things like medication or even just anxiety in general can also lead to ED. Erectile dysfunction is a clinical diagnosis. That means you discuss it with your doctor and they diagnose you as appropriate. There may be some extra additional testing that's required, but that may be urologist to urologist or just talking with your primary care doctor. The very best strategy for preventing erectile dysfunction is taking care of your heart and your general well-being. That includes things like exercise, diet, eating well, getting off the couch, reducing smoking and drinking of alcohol. Those are all lifestyle things that you can do. Additionally, treating medical conditions like diabetes, high blood pressure, those are all really important steps to preventing erectile dysfunction. Some of the benefits to seeing a specialist for ED include using an individualized approach to any diagnostic testing that needs to happen. That means just finding what's specific to you to help you understand why you may have ED and what treatment options may work or not work for you. Erectile dysfunction is a condition that we have a lot of tools for, so our toolbox is very deep. Treatments begin with things like pills. Viagra has been around since the 1990s and is a very safe treatment option. There are also more advanced medications, things like injections or gels that may work to bring blood to the penis. There's also surgeries that I perform called penile implant surgery, and those will be presented in later talks. I determine which treatment is right for you based on your history. What led to the erectile dysfunction? What are some lifestyle factors that may help you optimize your treatment, meaning make it work best for you? Ultimately, I ask patients 2 questions with each treatment because it can take a trial and error approach. The questions I ask are, did this treatment work? And do you like it? And you should be able to say yes to both of those questions. That's the treatment that's right for you. Satisfaction rates are different for each type of treatment. For instance, pills may have a very high satisfaction rate for someone with mild erectile dysfunction, but for someone more severe, they may not respond as well, so satisfaction may be lower. Things like injections into the penis tend to have a lower satisfaction rate, perhaps due to the use of needles and the lack of spontaneity, meaning it's not ready for you on demand. I think the highest satisfaction rate treatment is with a penile implant, and that's because it gives you back the time and the on-demand use of erections, puts you back in the driver's seat. In terms of the long-term consequences of not having erections, there's no detriment to your overall lifespan, meaning it won't cause you any significant harm. But not having erections for a long period of time can cause the penis to what's called fibrose, meaning it becomes a little bit scarred. This results in loss of penile length and reduced effectiveness of some of the treatments that we talk about.